Hello, my name is Dr. Dewan S. Raja. Today I will discuss about accessory spleen. An accessory spleen or splenunculus is a small extra piece of splenic tissue that is separate from the main spleen. It is a common anatomical variant found in about 10 to 30% of people and usually benign. Location typically found near the splenic hilum, along the splenic artery, or in the pancreas, particularly near or inside the tail of the pancreas. Omentum, maybe greater omentum or lesser omentum. The mesentery for the intestine. The splenic ligament, like that of the gastrosplenic ligament, or the linorenal ligament, or maybe even it may be very close to the diaphragm or close to the phrenicocholic ligaments, but it can be elsewhere in the abdomen. So it may be in the spermatic cord, maybe in the testis, maybe in the pelvis. Size usually small, less than 2 centimeter in diameter. Function has the same function as the spleen, like filtering blood, immune responses, and also recycling the RBC. RBC breakdown there, and spleen is the graveyard for the RBC. Okay, it is also the site of the B lymphocytes. So immune function is also important. Like the main spleen, the accessory spleen is also functional, but usually not very clinically significant because of its small size, around 2 centimeter in diameter, much smaller than that of the normal spleen. Okay, so if we look at the image, this I have picked up from Google, is a CT scan. Here, this is the accessory spleen. Here, this part is the hilum of the spleen, tail of the pancreas, the neck of the pancreas, head of the pancreas here. Okay, this is normal spleen, and this is the hilum of the spleen. So this is close to the tail of the pancreas, maybe in the substance of the pancreas. So in that situation, it may be confused with that of the pancreatic cancer. Okay, here we are saying this is an accessory spleen very close to the main spleen in the hilum of the spleen. Okay, in another case like this, it may be like this, but it may be anywhere in the abdomen, in any ligament, omentum, gastrosplenic ligament, splenorenal ligament, phrenicocholic ligament. Okay, it may be even in the spermatic cord. Rarely, it may be very, very rarely in the scrotum, close to the testis. Okay. So by CT scan, we can easily pick up the accessory spleen. We can use the ultrasonography also. Okay, arterial supply, accessory spleen are most commonly supplied by branches of the splenic artery. Okay, so that is usual because it is close to the hilum of the spleen, but it may be supplied by the short gastric artery. It may be supplied by the left gastroepiploic artery, may be supplied by other arteries if it is located far away from the main spleen. Venous drainage, blood from an accessory spleen typically drains into splenic vein, which joins the portal vein. Splenic vein unite with that of the superior mesenteric vein to form the portal vein. Portal vein goes to the liver and the porta hepatis. Lymphatic drainage, lymphatics from the of the accessory spleen drain into celiac lymph node. Celiac lymph node is close to the celiac trunk. Celiac trunk is a branch of the abdominal aorta, so we'll get celiac lymph node there. Similar to the main spleen also go to the celiac trunk area lymph node. There is celiac lymph node, and that will go to the cisterna chyli thoracic duct and open into the left venous angle at the root of the neck. The thoracic duct open, the junction between the left internal jugular vein, left subclavian vein. So the lymphatics go to the celiac group of lymph nodes around the celiac trunk of the abdominal aorta. Okay, we got the lymphatics. Accessory spleen diagnosis often discovered incidentally on imaging CT, MRI, and ultrasound. Clinical importance can enlarge and mimic lymphadenopathy or tumor. In case of splenectomy, an accessory spleen can remain functional and may contribute to recurrent disease, that is persistent thrombocytopenia in immune thrombocytopenic purpura or ITP. Okay, so when it is done, when splenectomy is done, it should be one should also take out the accessory spleen. Otherwise, it may be functional and may contribute to recurrent diseases. If infarction or torsion occur in the accessory spleen, compromised blood supply may lead to ischemia and pain, mimicking acute abdomen. We get acute abdominal pain the patient will get because of infarction or torsion. And that's all about the accessory spleen, its clinical significance, its location, its blood supply. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.